Well, for anyone contemplating breast implants, our next segment will answer many questions and will help you plan if surgery is something you've been thinking about. Leanne.
Probably not the right outfit. Never choose horizontal stripes when you're talking about breast augmentation with Dr. James Lacey of Canadoplastic and Cosmetic Surgery. We have an ongoing series where we're spending time with Dr. Lacey asking the questions you most commonly want the answers to, like how long is the downtime if you have a breast implant procedure?
Breast augmentation, it's usually just 5 to 7 days off work. And if we do a lift, maybe 10 to 14 days.
And we should say that you perform about 100 of these a year?
Yep.
You did
on average.
In Canada?
That's right.
So whenever you go to a gala, there's a whole sort of sea of your work there.
Yes.
We're going to look at some more of the images and walk over to the board because every one has a story, and in this case, every breast has a story. What did you do here, Dr. Lacey?
Well, not everyone looks as nice as this before surgery. So what I chose is a young lady, 31 years old, with breasts that are just a little deflated. She wanted a full, natural, attractive look. So this is sort of the easy surgery that we do. You take a good-looking breast and you make it look close to perfect.
This is, we have another profile, I believe, of the same woman.
That's right. And this is a three-quarter view, just meant to show the nice fullness of the breast, good cleavage, nice shape.
And this next patient is a very common situation for you, someone who has virtually no
Yeah, right. This is a
chest.
nursing mom. So she nursed 2 children. She's very flat, deflated. Her pecs are, in fact, more projecting than her breast. So to bring this into proportion, we put 2 breast implants. You notice that the distance between her breasts is naturally greater than the previous patient. This is her before. So some things we cannot change without fat grafting. So we will be talking about that in the next session.
And this is the same patient again, a different angle.
Correct. Here, this photo is meant to show that shallow deformity where the breast has involuted, and you look at the other photo, you can see how much fuller and attractive the breast is.
What sorts of things do patients tell you? I think we're going to show one more image, but what sorts of things do patients tell you? Are there personal reasons?
Deflated, droopy, unattractive, don't want to take my clothes off, keep my top on when I have sex with my boyfriend, all these kinds of things.
So we'll have you just kind of go through this. I never thought we'd actually be here at the screen with breastology with Dr.
This is the last photo. She has full breasts, but if you look carefully, there is that kind of concave deformity, and they just look a little empty, and they look, a little saggy. So if you go add a nice implant, you can really fill up the breast, make it look more voluptuous and more attractive.
And our next slide.
Finally, we have a young woman here with what we call a fairly masculine chest, who looks great when you put in some breast implants and feels great.
So we've said that the downtime on average is between 5 to 7 days, and cost again?
Cost is $9,500 for just augmentation, plus about $2,000 if there is a lift, skin work.
And just quickly, I know when we first had you on the program, you talked about the fact that oftentimes when you're dealing with a patient, you talk about the whole psychology of plastic and cosmetic surgery, because people have to realize that if they have something physical change, it doesn't necessarily mean they're going to have a life change. And I guess the same applies for the breast augmentation.
What I see is confidence. And in fact, the women come back empowered.